Hi, my name is Lauren Davis. I work with Atrium Health Union in the emergency department. We're going to show you the proper technique for blood culture collection per policy at Atrium Health. Ma'am, could you please tell me your name and birthday?
Melissa Teeter, 3/30/77.
Okay, I'm verifying that with your bracelet here, and it is accurate. The physician has put in an order for us to draw blood cultures, which is a place where we have to collect blood to send to the lab to see if there's any bacteria growing in your blood work.
Okay.
So we're going to do that process right now. So step one is you will come in and have your hands cleaned as you walk in the room to talk with your patient. Step two is you're going to prepare a clean area for your blood culture collection. We're just going to lay a drape over the area just to provide an extra precautionary for cleanness. We're going to don our appropriate PPE. We're going to grab our blood culture bottles, an aerobic and an anaerobic. Going to grab two 10 cc syringes, a butterfly needle, any gauge is appropriate as long as you have an appropriate vein size. We're going to have a transfer device. We're going to have a chlorhexidine skin prep device. And we're going to have an alcohol swab for the tops of each of our bottles. Okay? The next step we're going to do is find an appropriate vein location by tying a tourniquet on our patient's arm. Let me grab my tourniquet. Okay, so we have tied our tourniquet and found our proper location. The main key point here is to when you clean the appropriate location, you are not to touch the location again. So we're going to use our chlorhexidine cleaning prep. Not going to touch it. We're going to squeeze until the fluid has come through the sponge. We're going to clean in a cross-like motion, up and down, side to side, for a full 30 seconds. In order to confirm that all contaminants have been cleaned of the skin, you must clean for a full 30 seconds. Once your 30 seconds have passed, you will wait for a full 30 seconds to a minute for a full dry time. You must wait for the entire dry time as well. While we're waiting on our dry time, we're going to clean the tops of our bottles. So we're going to pop our lids. The tops of the bottles are cleaned with alcohol swabs. (10 to 15 seconds of scrub time on the top of each bottle with a different alcohol swab. We're going to let those completely air dry while we do our stick. So now that our skin is completely dry and we have cleaned our area, we will go straight to our butterfly needle. You will collect your blood in a syringe. The appropriate thing to do is to open the syringe and leave it in its sterile packaging so there's less risk for contamination on the end of the syringe. Okay. At this time, we will take the needle adapter off of our butterfly and connect our needle straight to our butterfly. Okay. We will now make our stick. 1, 2, 3. And you will pull back a full 10 cc's of blood in your syringe, carefully kinking off the end and setting it back in the sterile package. You will draw your second 10 cc syringe full, take off your tourniquet, apply gauze, and take out your needle and have your second full 10 cc syringe. If you're unable to get a full 10 cc's, that is okay. You want to get as much as possible, up to 20 cc's. Each bottle holds anywhere from 8 to 10 cc's of blood, and you want to start with your blue top first, which is your aerobic bottle. So we're going to let our patient rest their arm. We've already cleaned our blue top and our purple top. You're going to apply an adapter and it will pull the blood in for you. Again, not touching the adapter, not touching the tip of our syringe. We will put this in our bottle. Okay. Now that we have completed our draw, we will take the patient's sticker. We will verify, again, we've already verified the name and birthday with the patient. We'll verify that the sticker is the correct patient. We will date, time, place our initials, as well as the location and the amount of blood that we put in the bottle, and the location that it was drawn from. Of course, we would repeat this for a second set of cultures at a different location. We would not be drawing blood from an IV that's already established. It does need to be a brand new stick every time. And we would definitely chart in our chart the time, the date, the amount, and where we received our blood culture from. Thank you very much.